Good day. I'm John Supplett, Senior Director of Rural Health Services for the American Hospital Association. Today, we hear a story from Klamath Falls, Oregon, where local leaders have responded to the findings from their community health assessment and organized a broad based community effort to improve the health and well being of their community. The outcome is a certified Blue Zones community. Located at the base of the Southern Cascade Mountain Range, Sky Lakes Medical Center is a 176-bed independent hospital serving about 80,000 people in a 10,000 square mile area, including Klamath and Lake counties in south central Oregon and Modoc and Siskiyou counties in northern California. Sky Lakes is a sole community hospital serving a disproportionate number of Medicare and Medicaid patients, while also serving as a robust rural referral center. Joining me today are Paul Stewart, recently retired Sky Lakes Medical Center CEO, Joy McInnes, Executive Director at Klamath Works, and Merritt Driscoll, Director at Healthy Klamath. Thank you very much for sharing your story with us.
Of course. Thank you, John.
Thanks for having me.
Thanks for having us.
Through collaboration with the Healthy Klamath Coalition, Sky Lakes Medical Center began a comprehensive initiative to improve the health of the population, culminating in the creation of Klamath Works and recognition as a certified Blue Zones community, for which they won the prestigious Robert Wood Johnson Foundation Culture of Health Prize and AHA's Rural Hospital Leadership Team Award. Paul, what is the origin of this story? Where does discovery begin?
Back in about 2013, we were doing a lot of research on the determinants of health, and that's led to what we call today social determinants of health. We were looking at the county health rankings that come out of the University of Wisconsin Population Health Institute, and we recognized that Klamath County rated worse than the Oregon state average and really down near the bottom of all the counties in Oregon. And it wasn't really because of the healthcare services that we offered, it was because of other factors. High numbers of children living in poverty, high rates of unemployment, high rates of obesity and smoking. And we noted that the trends were worsening and certain populations were really deteriorating in our community. So what we were doing, we recognized clearly was not working. Long story short, we pulled together a broad collaborative group of representatives from business, schools, public health departments, civic leaders, and healthcare providers. We sat down and really started talking about what do we need to do differently in this community to improve the overall health of our community. That led to the creation of the Healthy Klamath Coalition, and we began implementing principles of planning and partnerships that would help us work more strongly together to guide a process that would analyze what are the priorities, what do we need to focus on, and how can we organize that work to move forward.
So through your discovery then, Paul, you identified the health indicators of the community, you made your needs assessment and your improvement plans, and we engaged Healthy Klamath. Merritt, help us understand what is the Healthy Klamath Coalition and of whom is it comprised?
So the Healthy Klamath Coalition is a multi-sector partnership made up of over 42 different organizations in the community, as Paul mentioned, across the community from many different sectors. And it's led by what we call the core four agencies. So that's Sky Lakes Medical Center, Klamath County Public Health, our local coordinated care organization, Cascade Health Alliance, and our local federally qualified health center, Klamath Health Partnership. So we formed back in 2012 as a response to these low county health rankings. And then from there, we conducted our first community health assessment, our first community health improvement plan. What we did is we looked at the data and formed our key priority areas. And we do this every 3 years. So right now, we're focusing on food insecurity, housing, maternal and child health, oral health, physical well-being, suicide prevention. And then we're working to meld this work with the Blue Zones Project key areas, which are improving our built environment, tobacco prevention, and improving the food systems as well. So Healthy Klamath, and of course, with the tremendous support of Sky Lakes Medical Center, was instrumental in bringing Blue Zones Project to Klamath Falls. And Blue Zones Project really gave us the needed structure and the direction to make measurable changes, specifically in terms of implementing best practices and passing policies that created the change that we're really looking for.
Mayor, you're sharing what is really an ambitious agenda, but to help people understand, how long has Healthy Klamath been in place?
So it was formed in 2012. Our first community health assessment and community health improvement plan came out in 2013. And then Blue Zones Project came to town in 2015. And that's when really the work accelerated. And then now we're working to continue that work, focusing on creating sustainability plans, health equity strategic plans, and continuing to focus on our priority areas.
Right. That's good to know. And you have some resources there to help you do that as well.
Yes, that's correct. If you wanted to learn more about Healthy Klamath or Blue Zones Project, you can go to healthyklamath.org. We have a tremendous set of local data. And then for your listeners out there, there's also a whole promising practices database where you can really kind of get the information that you're looking for and tailor it to the unique needs of your community.
That's a great resource. Thanks for sharing that, Meredith. And Joy, tell us then, what are the origins of Klamath Works and how does that fit into the picture?
So Klamath Works was started by just a group of concerned individuals that went around to different agencies and tried to figure out what was the source of our problem here in the community. Since 2014, Sky Lakes Medical Center and government agencies, faith-based organizations, law enforcement, and a number of business partners have rallied around this common goal and idea of helping those people in need to return to self-sufficiency by preparing them for work. And they understand that, work is so much more than just going to a job every day. It's really, stabilizing your life. So at the heart of that project is our Klamath Works job training program. And here we have job coaches and mentors that really work with our clients on an individualized basis and help them work through their barriers to employment so that they can not only get a job, but maintain that job long term. We are located on about an 18-acre property here in Klamath Falls, and the whole idea of this property is to have a variety of different businesses that work on kind of a holistic approach to helping individuals overcome those barriers. So there's, mental health services available and addiction issues available and a variety of different things to create a whole self-sufficiency campus. And Sky Lakes has been a really great supporter of that. They have a great vision for how to help those people in a well-rounded way. So that's how we got started.
We have resources as well. Share with the audience how you're organized as Klamath Works.
So we are a nonprofit agency here, and we have job coaches again and mentors that sit down with each client individually and work out a plan with the client as to what it is that's best going to fit for them. Every single case is different. So, it's a lot of handholding and helping people work through maybe legal issues or addiction issues or regaining driver's licenses, stabilizing their family unit, all those little pieces that go into making somebody stable so that they can then be a good, efficient, productive employee.
So, and that's what's important, is that this is a comprehensive, integrated social service model. It's not just job placement. And you're working with those who need to help them support themselves financially, but then also to help them realize their full human potential.
Absolutely.
So, Paul, perhaps one of the more innovative programs built into this model is the Wellness Center. And for those listening, please understand that this is not a fitness center. That is a component of the program, but it is much more. So, Paul, please describe the Wellness Center and how it fits into the bigger picture of Healthy Klamath.
Back when Healthy Klamath was in essence a group of volunteers that were coming together to collaborate on these projects and then going back to their real day jobs, we recognized that we needed a little bit more infrastructure and probably some dedicated staff to help guide some of the work. And at the same time, as is the same for many hospitals, we are self-insured for our health insurance for our employees. And we recognized that we had some issues that were contributing to higher than anticipated expenses in our health plan. Long story short, we had a physician who had gone through our residency program, had graduated, and then had gone back to school to obtain a master's in public health. And she was very focused on community health. And we connected with her. She was graduating from Johns Hopkins University and enticed her to come back to the community and begin this wellness center. And she brought with her a master's trained RN to partner with her, and they became the core staff for the wellness center. The focus of the wellness center essentially was on lifestyle. It was on trying to mitigate the chronic diseases that are associated with poor lifestyle and poor habits. And chief among these was helping people learn how to eat and manage their weight better so that we could decrease the incidence of diabetes, high blood pressure, congestive heart failure. And in the first year, it was so successful with the individuals, our employees that we had enrolled in the program, we then expanded it to make it available to others in the community. Those two individuals, Dr. Stephanie Van Dyke and Catherine Pope, really became the fire starters for pursuing the Blue Zones project. They too were very interested in helping build a structure, a framework around which all of these community volunteers could work and focus our efforts. The Wellness Center has continued to grow and develop. It includes behavioral modification, nutrition counseling, cooking classes, mindfulness, coaching on fitness, all really aimed at helping people adopt a healthier lifestyle, decrease the incidence of chronic disease, and in many cases, reverse chronic disease problems. And they engage with the local community and policy development, environments to create a better built environment that lends itself to an active lifestyle, and just helping our community be more innovative.
So that's terrific. Thank you, Paul. So we've talked about Healthy Klamath. We've talked about Klamath Works. We've talked about the Wellness Center and how all that has converged as a certified Blue Zones community. And you've been at this for a decade. So the question is, has it worked? Joy?
Well, I certainly like to think so. You know, we are certainly a work in progress, and we have our wins and we have our losses. But since beginning seeing clients 5.5 years ago, we have helped over close to 1,800 individuals obtain over 1,280 jobs here in our community. But I think the bigger story and the bigger thing that we are doing is really helping change lives and helping people find self-confidence and a purpose again. We've started several paid supported work opportunities so that our clients who really struggle with what a job is or any kind of job history can work right alongside job coaches who help them develop personal stabilization. They teach them job skills that are transferable to any kind of a job, basically, and really truly try to teach what the benefits of having a job that is so much more than just the paycheck.
So, Mayor, you've been at this since its inception a decade ago. So tell us, has Healthy Klamath made a difference in the community?
I think it's a continuous journey and it's working. We still have a lot of work to do additionally. We have seen measurable outcomes. For instance, Klamath Falls well-being has remained steady when the rest of the nation and even our state was declining in well-being. We also saw significant outcomes that we were looking to see. For instance, the reduction in tobacco rates by 24% since 2015. People in our community are feeling more proud to live in Klamath Falls and Klamath County, and that's something that we were struggling with back in the day. Additionally, there's a 14% increase of people feeling safe in our community, and our graduation rates are increasing. These are all things that we were looking to improve, and the data showed that we did, in fact, improve. So it's working, but again, it's a journey, and we have a lot of work to still do.
Well, and it's interesting, increased graduation rates, healthier people, reduced crime, a better housing, food security are not typically the things that hospitals have pursued in the past, Paul, but now with the advent of what we're calling social determinants of health, Sky Lakes Medical Center has jumped in with both feet. So what do you think? Has this been a success for you at Sky Lakes Medical Center?
It has. There's no question it has. Now, by the same token, we recognize we knew going into it, it was a long-term journey. not just long term, but perhaps generational in nature. To create a healthier generation of people, we needed to start with our own kids, get them more active and eating better and adopting healthier lifestyles and avoiding alcohol and drugs and smoking. But we believe that it has positioned us in an excellent way for what are emerging as value-based models for payment and delivery. And we have a lot of experience with that. We've been working in a value-based payment system for our Medicaid population for over 20 years. That program has been very successful, and I think it is because we already have the foundation of focusing on behavior modification and social determinants of health. As a result, that Medicaid program has been profitable. It has compensated local providers way above commercial insurance rates. And at the same time, I think making a measurable difference in the health and well-being of the people that we serve. It'll take some time before we see all of the metrics align in terms of decreasing chronic disease, but we have seen reduced readmissions to the hospital. We believe we're doing a better job reducing substance abuse. We've organized behavioral health services in a way that integrates more fully with physical health, and I think is producing better outcomes. And I think we're helping people learn and educate the community that a lot of their health is in their own hands. It's not up to the hospital and your doctor to fix everything that goes wrong. You've got to take some personal responsibility. And we're seeing more people step up to that plate, more activity in the community, more bike riding, more going to the park, kids playing in the park, being active, and more people getting engaged and saying, hey, I want to be a part of making this a healthier community. I want to step up and help build better parks and bike trails and get our kids in youth sports and the like. And that's going to have a definite payback to the healthcare system over the long term.
Well, and you mentioned some important things. We hear the clinical case, the human services case, but you've also presented the business case for doing the things that you've done at Sky Lakes. And what I'm hearing is the resounding ability to empower individuals within the community to really take control of their own lives and their health status and to make a positive change in the way they live their lives, all of which contributes to the greater health of the community. So tell us then, what does the future hold for Sky Lakes and Healthy Klamath? And Merritt, why don't you start?
So I would say our future is looking bright. As I mentioned previously, we have restructured and formalized our partnerships. We're working on a sustainability plan, a health equity strategic plan. We just finished up our community health assessment and we're getting community feedback and we'll transition into our community health improvement plan. Additionally, we have a number of built environment projects that we're working on specifically to increase physical activity. In terms of tobacco, we're working with youth to reduce vaping. We're continuing to focus on our community health improvement plan focus areas, and ultimately with the goal of making Klamath Falls a better place to live, work, learn, and play.
Great, fantastic. Joy, how about you in Klamath Works? What do you see as your future?
We're working on building more supported work opportunities. We learned really early on that getting the job is the easy part, but being able to maintain that job long term, it takes a whole lot more. So the more supported work opportunities we can offer so that people are really comfortable with what a job is, what to expect and from it, I think will help. So we're working on developing some construction training supported work opportunities because our community is really in need of additional people working in the trades. So by doing that, we can provide both employment for our folks, but also training so that they can take that out to an unsupported job, which provides a good living wage kind of job for folks in our community. And we just want to continue to develop more and more of those supported work opportunities to work different areas.
Great, thanks very much. Paul, what about Sky Lakes? What does the future hold for them?
Well, as we've referenced, this is a long-term journey. There isn't really a destination or an end goal. It's a constant endeavor to help people lead a healthier life and to decrease the burden of disease and chronic illness. I think we've got a great foundation and our future is bright. I'll tell you, one of the things that I noticed when I moved to this community many years ago is not only was it economically depressed and in a relatively poor health status, it had a pretty low self-esteem. people really didn't brag about our community as a great place to live and didn't feel that sense of self-esteem and well-being. I think that has dramatically changed over the years. And today, this is a more robust community. It's a place where people are proud to call it home. We have people outside enjoying the great outdoor recreation that we have. We have great parks and bike trails and more economic development. Our future is truly bright. But we really need to decrease the dependence on hospitals to fix things and help people avoid disease to begin with. And that's where we're going to continue to focus our efforts to create a healthier community.
Well, I think you've all done an exceptional job in achieving those goals, improving confidence, empowering the community, and improving the life of those that live in Klamath Falls in your market area. Really has been at the center of your efforts, and I think you've done a phenomenal job doing that. And I hope the folks who have listened today can hear things that you've done that they can apply back home when they consider their own circumstances. For their efforts, Klamath Falls was selected as Oregon's first certified Blue Zones community. They received the prestigious 2018 Robert Wood Johnson Foundation Culture of Health Prize and the 2021 AHA Rural Hospital Leadership Team Award. And congratulations on all fronts. The strength of rural healthcare is critical to the fabric of American healthcare. And it is our mission to safeguard it, improve it, expand it, and advance it for future generations. Thank you to our country's healthcare providers for their hard work, dedication, and sacrifice in this trying time. And thank you to hospital and health system leaders like Paul Stewart, Joy McInnes, and Merritt Driscoll, and the nurses, physicians, social workers, counselors caring for the community in Klamath Falls and across rural America. This is one of several stories of how rural hospitals are rising to the challenge to transform healthcare and introduce innovations to improve the health of their communities. Visit our website at www.aha.org to access these and other resources available to hospitals and health systems. Thank you for listening. This is an AHA Advancing Health podcast.